I'd like to first of all start by thanking the committee for a really good meeting today, a good seminar. I think you've heard a lot of broad perspectives. You've heard sort of both sides of the question. I think that's an important thing when you're debating a topic as important as this. I also would like to recognize Senator Bolcom, because I think when Senator Hatch was recognizing folks, he might have missed you. So it's good to have you here. And, you know, there's some other people in this room that over the course of the last couple of years, well, longer than that, but certainly the last couple of years, have just been absolutely critical to the work of the commission, the work of the last commission, and each of us as legislators, and that's our staff. And I know both Republican and Democrat staff are in the room, as well as LSA staff, so thank you all. Because you know what, when I need information, I've always been able to go to Democrat staff or Republican staff for data or for information about bills. We've always been able to go to the bipartisan, nonpartisan LSA, and I think that's what's allowed us to do a lot of the really good work that we've done in the past several years. Chris, I don't know how in the world I let you talk me into batting cleanup, but I'm going to try and do that here today and work with bifocals and screens and buttons and hope I don't foul it up too much. You know, here, let me do this. It is important to remember that every American is not thrilled with the bill that was enacted into law. Yesterday's Rasmussen Report survey found that 61% of Americans surveyed expect the cost of health care to go up because of the health care reform bill that was passed in Congress and signed into law. 20 states have gone so far as to challenge the constitutionality of the bill, and they will have their day in court in September in Florida. 56% of Americans want the whole bill repealed. This might be a good place to insert, I guess, in response to Senator Hatch's slides, that the Revere America, I encourage you all to go to the site. You know, they're talking about repeal and replacing portions of this bill that are problematic. And I think we all maybe have some concerns over this bill in one aspect or another. So it's not quite as dramatic as what some would make it sound. But there's clearly an image problem here, and part of the problem is the lack of public comment. You know, the public has a 2,700-page bill that they have no clue what's in. Senator Hatch rightly pointed out that, they didn't know any of these things that he had on his slide were parts of the bill. Well, as with any survey, this is a smart room, so I would encourage you all to look at the questions and how they were posed, because you can elicit answers, you know, in any survey that probably get to where you want to be. So I just encourage you all to critically look at the data. But nonetheless, there is an image problem with this, and people don't have much information. In fact, currently, there is no public comment going on with the rulemaking either. So we'll probably have some of the same issues as we proceed with that. There are many Iowans who are skeptical when it comes to the impact of this bill, and I hear their concerns every day. They believe that the bill will increase their health care insurance costs. They're not alone. The Congressional Budget Office has said that the health insurance costs will continue to go up even with this bill. The CBO says Americans will pay $2,100 more per year because of the new law. Iowans also believe that the bill will cut Medicare benefits. And you know who agrees with them? The chief actuary of CMS, who said the new revisions will result in a less generous benefit package. Iowans also think the bill will increase taxes. Guess who agrees with that? The Department of Justice, who is arguing in the court briefs that this bill is constitutional because the individual mandate is a tax. And Iowans think the health care reform bill will add more to the national debt. The minority staff for the Senate Budget Committee says it will add $2.4 trillion to the debt. We've heard lots of statistics here today, and so you need to do your research and decide. Massachusetts was the first to fully enact the health care reform in 2006. Since that time, much of what Washington has passed is based on the Massachusetts approach, it's important that we understand what is working and what is not working. Massachusetts focused on extending coverage, not on containing costs. They've been successful in achieving that goal, but the impact has not been entirely what was expected. Emergency rooms are not less busy because many of the new enrollees can't find a healthcare provider. The state did not increase its number of providers, and many of the existing providers are not taking any more new patients. Insurance rates continue to increase, some to the point where employers have determined it's cheaper to pay the penalty for not participating than to pay the premium costs. Facing these issues, the leadership in Massachusetts has proposed interesting solutions. The governor implemented a cap in health insurance rate increases, but that was challenged and overturned by the state's insurance regulators because it would leave many of the carriers insolvent. The legislature is looking to act as well. One solution is to take $100 million of hospital funding and use it to buy down insurance premiums for small businesses. Needless to say, some in the Bay State have a problem with that idea as well. Another idea floating around is to create association health plans, allowing small businesses to come together and negotiate lower rates. Does that sound familiar to anyone in the room? And to address the shortage in providers, one member of the Massachusetts Senate is proposing to make participation in Medicare and Medicaid mandatory to getting a license to practice in the state. Utah's taken a different approach. They've set up an exchange that has a big education component to it, so individuals can make choices based on what's information that they've gleaned from the exchange that they can find online. HSAs are part of their plan, and sliding scales will help contain costs. Iowans are also concerned about specific provisions in the bill that we as legislators have to address. The bill establishes a high-risk pool for those residents with chronic conditions that can't get covered. Sue Voss discussed this at length here earlier, and no one argues that that's a bad idea. We've had one in Iowa, HIP Iowa, for a long time. And it covers about 3,000 Iowans through assessments on insurers and premium payments from the enrollees. But instead of expanding HIP Iowa, we have to create a second risk pool. And with it, we have two sets of rules. Congress set the premiums and copays for the new pool. They are lower than the HIP Iowa plan, and they don't require participants to exhaust COBRA benefits, which HIP Iowa does require. So the programs are very different. Now we've got people that are wanting to know, can they move from pool 1 to pool 2? And as I think you've heard earlier, that won't be allowed unless you go 6 months without coverage, which is really not what we're after either. So then there's funding, and that's going to be a problem because when you combine the federal funds and the allowed premiums, it would seem that we can serve fewer than about 1,000 Iowans, despite the fact that the General Accountability Office estimates that actually 34,000 Iowans might qualify or be eligible for this kind of program. So what happens when the slots are full and we have to look at how we do the pool differently? A provision of the new law that is getting a lot of attention these days is the Medicare loss ratios for health insurers. Under the bill, plans would have to spend 85% of planned revenue on services. Now that seems logical. It seems like that's what you'd want to do, is have the plans putting that amount of money back into the services provided. But what if you live in a state like Iowa where you have only a few insurance carriers offering insurance, health insurance? And what if one of those carriers can't meet the 85% requirement? Congress actually had the foresight to give states the ability to seek a waiver of the rule, and the first applicant is Maine. Their number 2 carrier is at 67%, and their insurance commissioner has determined that the company cannot get to 85%. So they become the first state to ask for a waiver. Lawmakers and I were going to need to know if we will have to ask for a waiver so that we can figure out how we're going to actually achieve competition for the health care coverage. Iowans want choice and competition in the hopes that it will contain cost growth in this area. And we need to know what we can do to expand this competition. An item that generates concern on Main Street in my communities is a requirement for state to set up the health insurance exchanges. And we've touched on this on and off a lot today, and then we've talked about Massachusetts with the Connector, and that's essentially a state-run health insurance agency. The Connector provides information and assistance in choosing and signing up for plans. Utah, as I said before, adopted an information exchange where citizens get the information and then go out and actually purchase the coverage. This is a major issue on Main Street. That's because your local insurance agents are very concerned about the exchange. They see the Massachusetts model as direct competition for the services that they offer. And there's no guarantee that the employees of the exchange would have to undergo the same rigorous training and licensing that insurance agents must do today. The legislature will have to decide if we trust our insurance agents to do the work or if we want to expand government to compete with them. If you page through the bill and the numerous analysis of it, you may be surprised to see that the number of items that the state insurance agencies will now have to report to the Department of Health and Human Services. It's a concern that folks in Washington will now be making the decisions on health insurance instead of local commissioners and local legislators. But it appears that the bill places state insurance commissioners under the secretary. So who takes priority? And I don't mean that in any way disrespectfully to Commissioner Voss. I think she does a wonderful job, but I think that does create a sort of a competitive environment for her to have to try and sort out where who she's actually working for, Washington or Iowans. The biggest issue facing Iowa and the legislature currently is Medicaid. Today, 327,000 Iowans are on Medicaid. That is an increase of 27,164 from last year. With the expanded enrollment, providers have had to face reductions in reimbursement. And next year, the legislature will have to find $547 million in new funds to continue the program as it is today. The health care reform bill increases eligibility levels for Medicaid to 133% of poverty. And for a few years, Congress will pay for that expansion. But that doesn't last forever. And some of the cost may be shifted to the states. Will states like Iowa be able to handle this additional burden? The same applies for provider rates. In 2013 and 2014, certain provider categories will receive a boost. But in order to cut the cost of the bill, those rate increases last for just 2 years. And then what happens? What about providers that are not getting increases? Will the states need to kind of provide increases to make it fair for them? Will providers remain in the program? We've had some discussion about that today. In a number of states, providers are no longer taking Medicare and Medicaid patients. And believe me, I do hear that from providers today, and I bet there's a lot of people in this room that do as well. Some are dropping Medicaid, and some are talking about dropping Medicare as well. What do Iowans want? They want cost containment. They want the rise of their insurance costs to slow down. We have to find ways to make that happen, like offering coverage alternatives, emphasizing preventative care. I just can't tell you how much I agree with Dr. McGuire today that prevention and chronic disease management is so critical to this future debate. It's a very small part of the bill, I think something like 2 or 3 pages, that consumes 70 to 80% of the dollars we spend in health care. Shouldn't it be consuming 70 to 80% of the time we're spending on sorting this out and figuring out how we can best address these issues for our constituents? They want quality health care. And certainly we have had opportunity to work on quality in this state, but we've barely scratched the surface. They also want transparency. They want to be able to understand their insurance coverage and their medical bills. Hopefully the exchange will help that. Again, I thank you all for being here today. I encourage you to really think about all this information you've gotten today. Take it home, look around on the internet, and make some critical decisions about fact and fiction and where we need to be spending some time really sorting this all out, because we all want to benefit Iowans. And we've worked really hard in the past to come up with good bipartisan legislation for Iowans that did put us in a really good position around the country. And that's one of the reasons that we believe that this is absolutely better handled in Iowa than from Washington. So thank you, and we welcome your questions.